Courtney, thank you so much for stopping by today. I wish we were, maybe under some different circumstances, maybe some warmer temperatures, but we so do appreciate you making time out of your day to, again, help everybody deal with these cold temperatures that we are experiencing here in West Michigan right now.
Yeah, thanks so much for having me.
Of course, I guess that kind of leads to the first question, I personally have kind of experienced, these cold temperatures before. I used to live in Milwaukee, and I think back in 2019, we had that crazy polar vortex where I think wind chills were down in the negative 60s at this point. It's not that cold here, but we are in those negative wind chills. Have you ever this is one of the coldest stretches I've ever been in. I don't know about you, though.
Oh, yeah. Polar vortex affected Michigan as well, certainly with that lake effect temperature. So as a lifelong Michigander, no stranger to the cold.
Yeah, right. Absolutely. Well, and probably a little bit more snow than maybe the folks in Milwaukee have been getting. It's something that we've also been touching on quite a bit here and kind of goes into this conversation a little bit more, Courtney. We want to, of course, talk about the dangers that people will be facing. We'll also go over some tips to not only keep yourself safe, but, your kids, other family members, pets as well over the next little bit of this conversation. But let's start with some of those dangers, Courtney, if you don't mind. With how cold it is, how long should we really be outside, before it gets considered way too dangerous? At what point would you maybe say, okay, if you have to clean off your car or maybe you want to do a little bit of shoveling outside, give yourself, this amount of time before you should be heading back in?
Yeah, that's a great question. So with temperatures below zero, okay for adults to be outside wearing proper layers. So maybe a base layer with some moisture wicking fabric, something like wool or synthetic material, probably not cotton, and then layered on top with some fleece and then a waterproof, windproof layer. That would be ideal. An adult could be outside for maybe 15 minutes or so, kind of monitoring how we feel, shoveling, brushing off the car, before we should come back inside, warm up again before venturing out. But in temperatures below zero, kids really shouldn't be outside for any amount of time. If we have to go from home to the car, something like that, they do need to be wearing appropriate layers. But this is not the safest time to let kids be playing outside for any amount of time.
Right. No, and I think we'll touch on the kid aspect to this as well, because we know a lot of kids are, of course, out of school on this Friday. But Courtney, what are some of the issues, particularly with this cold, that we could be facing? I know frostbite is a big one, hypothermia another one. What are we really in danger of if we stay outside during these temperatures?
Yeah, so let's talk a little bit more about frostbite. So frostbite is injury to the skin or deeper tissues that happens due to cold exposure. Ice crystals can actually form in between skin cells and deeper tissue. And this can lead to some immediate problems like infection or gangrene, but unfortunately can also lead to more permanent problems like chronic pain, disruption of the normal function of the muscles in that area. Unfortunately can also lead to necrosis or tissue death, which sometimes lead to loss of limb. So really severe possible outcomes for that, so worth avoiding. In individuals who are fairer with lighter skin tones, frostbite can look like white, kind of grayish yellow discoloration to the extremities. And I should mention that the areas most commonly affected by frostbite are the extremities. So it's the hands and fingers, it's the feet and toes, and it's the face, including ears. So we can get some discoloration to the affected tissue. Sometimes that area also feels more firm or almost squishy. We lose that soft sort of feel to it. But those visible skin changes might be a little harder to pick up on in someone with a darker skin tone. So we need to have a higher level of caution. If you think you might have frostbite or your loved one might have frostbite, it would be very important to get them to emergency care immediately to get them evaluated.
Absolutely. I think that is kind of my next question for you, Courtney, is that maybe if we do notice some discoloration, or maybe we've been outside, maybe we think we might have frostbite, maybe we're having a little bit of trouble breathing. At what point is the need to go to the doctor's office or go see your doctor, go to urgent care? When does that become the point that it's a must? It's not I kind of should, do I want to wait for the roads to get a little clear? This is a must you have to go to.
Yeah, another great question. So if you've been outside, you come back in, maybe your fingers are a little bit cold, numb, you've come back inside to a warmer environment, you're starting to recover. The tissue can sometimes look like a little red when we're recovering. We regain function and feeling rather quickly. We don't need to seek medical attention for that. That's pretty routine. But if you come back inside, you're in a warmer environment, we're taking off wet items of clothing, we're changing into something dry to help us recover. And if the area is remaining that kind of pale white color, or if it's turning kind of a blue-gray color, that would be very concerning. And if you're not quickly regaining the sensory function there, if you continue to feel numb, or if you continue to feel like, ooh, my fingers just aren't quite moving around like they usually do, so feel kind of like disoriented a little bit, then it would be important to get medical attention.
Absolutely. Well, and Courtney, you kind of were hitting on it, and I really want to make this its own question, if you don't mind, just kind of talking about the proper ways of layering. There are some people that unfortunately are going to have to work out in these elements. They are going to be, road crews, the post office, different employees are going to be out dealing with this. Even dog owners, they might have to go and let their dogs outside. So there are going to be people out here. What is the best way, or really tips as far as making sure that you're layered properly? I know from experience, we've seen, in A Christmas Story, the mom's kind of going a little crazy with all the different coats and gloves and hats and everything. So there is an extreme level to this, but there is also an appropriate amount of layering that you should be putting on.
Absolutely. And the moms are onto something. Yeah. Okay. We know the moms
know best. We know.
Moms do know best. But yeah, so I mentioned a little earlier to at least have those 3 layers. So one, the base layer, and that's really important for people who are working outdoors because it gets a little complicated. If we're working hard outside, we're working up a sweat. And unfortunately, the moisture kind of enhances the degree to which temperature can transfer from the air to the body. We don't want more cold transfer from the air to someone's body. So that's why it's really important to choose one of those like moisture wicking fabrics, or like I said, some like a wool, and not cotton, not something that's going to like get wet and sweaty and then stay wet and sweaty. That's going to pose more of a risk. So we need to choose the correct base layer. Next, we would choose something that's really insulated. So something like a fleece, a little thicker, traps heat in. And then ideally we would have something waterproof and windproof, like a shell on the outside. Yep. And so that goes for like jackets, also goes for gloves and hats.
All right, great stuff. Well, and again, we also touched on the fact that kids probably shouldn't be outside during these cold stretches that we're going to be having here in West Michigan. But we also know that kids love playing outside. They have all this energy that they're trying to get out. Any tips that maybe you would offer parents right now as far as how to kind of mitigate that, or at least pass on the information to their kids in a more kid-friendly way that, hey, this is a really dangerous situation, really dangerous temperatures to be dealing with right now?
Yeah, so first of all, I'm right there with you. I have 3 little kids under the age of 10. So they're rambunctious. Everyone's getting a little stir crazy. We've been off school for several days this week and now going into the weekend. So kids do need physical activity. And so we do need to honor that and try to help them find ways to get their activity and kind of move around. But let's try to do that safely inside. Like I said, it's too cold for kids to be playing outside right now when the temperature is lower than 0. So, for example, my older kids like to go to the Y with me. Sometimes we'll do things like the stair climber or the treadmill, or just run around, shoot hoops a little bit. You can introduce your kid to weightlifting, like I started doing recently. You could do family dance videos at home. This would also be a really good weekend to do some family game nights, look at old family pictures, read books as a family. So a lot of other like wholesome ways that we can still have family time together without exposing kids to the cold for too long.
Right. No, and we're just coming off the holidays. Everybody was spending time together, looking through picture books. Again, why not bring them back out? Everybody had so much fun just a couple of weeks ago with that. Bring it back out. It
always feels good.
Exactly. And staying safe is really the key there. Courtney, we have enjoyed this conversation so much. Before we let you go, any last final tips you'd like to offer to anybody watching, whether it's how to stay safe during these cold temperatures if you have to be outside, or really how to deal with maybe some issues that might be associated with the cold, or really even maybe how to take care of those pets?
Yeah, so I practice family medicine. I'm a primary care provider. And so a lot of the patients that I see, come into the office to be evaluated. And for most appointments, that's very appropriate. But there is a lot that can be done virtually in medicine these days. And so like this past week, especially provided a lot of opportunity to try to maximize like, okay, what can be done reasonably, clinically appropriate in a virtual way.
Right.
So if we're following up on like perhaps a treatment change that doesn't require me listening to someone's lungs or looking in someone's ear, like can this safely be done over a telehealth visit where the patient still reaps the benefit of getting, an evaluation, not putting that off, having to reschedule for a week or two or longer in some instances, but still gets the attention they need, but can stay safe at home. We don't have to get out on the roads,
Right.
Risk an accident or risk falling. That's what I would stress is just if you need medical attention and you don't feel safe leaving the house, could telehealth be an option? So to consider and to ask if your primary care provider offers telehealth services, if that's an option for you. Of course, there are still times when it is really only appropriate to have someone in the office and we just have to do it that way. But a lot can be done virtually.
Yeah, no, and again, really worth mentioning, with just the way that the roads could be turning over these next couple of days, probably best to stay off the roadways if you can. So again, another great tip there. Courtney, thank you so much for stopping by, for not only providing us all these great tips, but again, just really passing along all the information across, adults, kids, everything. So I can't thank you enough for stopping by today.
Thanks again for having me.
Of course.